Hello everyone, especially to our classroom instructor and to my fellow classmates. I'm Bianca Ramos and I'm going to discuss about the substance abuse. For the definition, substance abuse are disorders due to psychoactive substance use. They refer to conditions arising from the abuse of alcohol, psychoactive drugs, and other chemicals such as volatile solvents. When we say psychotropic, it is also known as psychoactive substance. So these are a drug or substance that affects how the brain works and causes changes in mood awareness, thoughts, feelings, or behaviors. The example of psychoactive or psychotropic substance are alcohol, caffeine, nicotine, marijuana, and certain pain medications. So here are the different terminologies related to this topic. First is substance. It refers to any drugs, medications, or toxins that shares the potential of abuse. Addiction is a physiological and psychological dependence on alcohol or other drugs of abuse that affects the central nervous system in such a way that withdrawal symptoms are experienced when the substance is discontinued. Abuse refers to maladaptive pattern of substance use that impairs health in a broad sense, and dependence refers to certain physiological and psychological phenomena induced by the repeated taking of substance. Tolerance is a state in which after repeated administration, a drug produces a decreased effect, or increasing doses are required to produce the same effect. While withdrawal state is a group of signs and symptoms recurring when a drug is reduced in amount or withdrawn, which lasts for a limited time. For the etiology, first is the biological factors. It includes genetic vulnerability and biochemical factors. For the genetic vulnerability, first is the family history of substance use disorders, because family history is one of addiction's biggest risk factors, since while the environment a person grows up in, along with a person's behavior, influences whether he or she becomes addicted to drugs, genetic plays a key role as well. For the biochemical factors, role of dopamine and norepinephrine have been implicated in cocaine, ethanol, and opioid dependence, and abnormalities in alcohol dehydrogenase or in the neurotransmitter mechanisms are thought to play a role in alcohol dependence. Next is the psychological factor. First is the general rebelliousness or a person fight against or refuse to obey the authority. Kasi nga, waon itama nga waon sa tama nga pag-iisip. Next is sense of inferiority and also poor muscle control, because an individual who has difficulty resisting the urge to engage in a certain behavior like sa paggamit at mga substances. Also, low self-esteem, similar man sa sense of inferiority, and inability to cope up with the pressures of living in society, like poor stress management skills. Next is loneliness or unmet needs and desire to escape from reality. Since if gatay ka at drugs, hay gahalunsinate ka or matakasan mo imong mga problems. Next is desire to experiment or a sense of adventure. Diba karang gasuod tag sense of curiosity and pleasure-seeking, machoism, since may andang strong sense of masculine pride if they think nga mag-take sa diet yung substance or mga substances, and sexual immaturity. For the social factors, it includes religious reasons and peer pressure, urbanization, extended period of education, unemployment, overcrowding, poor social support, effects of television and other mass media, and occupation. So for the occupation, substance abuse or substance use is more common in chefs, barmen, executives, salesmen, actors, entertainers, army personnel, journalists, and medical personnel, and etc. The types of commonly used psychotropic substances are the following, such as alcohol, opioids, cannabis, cocaine, amphetamines, and other sympathomimetics, sedatives, and hypnotics. Examples are barbiturates and inhalants. Examples are volatile solvents, nicotine, and other stimulants such as caffeine. For the signs and symptoms of substance abuse, it includes small physical symptoms such as slight alterations to physical appearance, bloodshot eyes or red eyes, frequent abnormal puffiness and flushed or washed out color, frequent sniffing, slurred speech, persistent itching in a specific area of the body, and impulsive pulling down of sleeves to hide marks. Another is overall appearance because those long-term abuse of drugs and alcohol use result in drastic changes to physical appearance. And lastly, paraphernalia. It is an obvious indicator or sign if you find equipment in someone's room or among their things. So some common items include cigarette, wrapping papers, pipes and lighters, syringes, burnt spoons or bottle tops, razor blades, and cutting surfaces like mirror or glass. Substance abuse also results in a rapid or noticeable changes from what was previously considered normal for the person. Some changes to watch for are struggling with limits, loss of interest, mood swings, reclusive and private behavior because substance abuse disorder are incredibly isolating and user experiences shame and fears social stigma, and also it can induce paranoia. Defensiveness, erratic behavior because it can lead users to reckless or dangerous actions. And lastly, changes in sleep habits because drug abuse tends to wreak havoc on users' sleeping habits. Finally, for the therapy used in substance abuse or addiction treatment and recovery, the following are some of the most common types of treatment for addiction. First is the medical detox, inpatient or outpatient rehab, online rehab. So this type of program allows clients to attend remote video treatment sessions from the comfort of their homes or while traveling. Court-ordered rehab for individuals who are arrested and charged with drug-related crimes. Sober living programs. It provides safe, supportive, drug and alcohol-free living environments for people in recovery. Aftercare offers peer accountability with weekly meetings, support services. Teen drug rehab programs tailored for teenagers, and lastly, holistic drug rehab, offer treatment services that are designed to enhance clients' wellness through their mind, body, and spirit. And examples for this type of rehab is acupuncture, yoga, meditation, or nutritional counseling. So that is all for.
According to World Health Organization, approximately 3.3 million deaths in 2012 were the result of harmful use of alcohol. Not only can alcohol abuse lead to death, but it can also increase the risk of developing more than 200 diseases, including but not limited to some forms of cancer, cirrhosis, tuberculosis, and pneumonia. Furthermore, alcohol use can lead to violence and related injuries. Consequences of substance abuse. This commonly leads to physical dependence, psychological dependence, or both. It may cause unhealthy lifestyle and behaviors such as poor diet. Chronic substance abuse impairs social and occupational functioning and creating personal, professional, financial, and legal problems such as drug seeking is commonly associated with illegal activities such as robbery and assault. Drug use beginning in early adolescence may lead to emotional and behavioral problems, including depression, family problems with relations, problems with or failure to complete school, and chronic substance abuse problems. In pregnant women, substance abuse jeopardizes or danger of lost fetal well-being. The psychoactive substances produces negative outcomes in many patients, including maladaptive behavior, bad trips, drug-induced psychosis, and even long-term psychosis. IV drug abuse may lead to life-threatening complications because it directly inserted into our bloodstreams. Illicit drugs pose added dangers. Materials used to dilute them can cause toxic or allergic reactions. Alcohol dependence syndrome, or alcohol means essence. In anciently, it is called as magnus has, which is derived from Arabic word. Alcoholism refers to the use of alcoholic beverages to the point of causing damage to the individual, society, or both. Or chronic dependence of alcohol characterized by excessive and compulsive drinking that produce disturbances in mental or cognitive level of functioning, which interferes with social and economic level. Properties of alcohol. So alcohol is a clear colored liquid with a strong burning taste. The rate of absorption of alcohol into the bloodstream is more rapid than its elimination. Absorption of alcohol into the bloodstream is slower when food is present in the stomach. That's why it is advisable that before we take any alcohol products or beverages, we must make sure that we have any food that we consume. A small amount is excreted through urine and a small amount is exhaled. Risk factors. It includes chaotic home environment and effective parenting, wherein, as you can see or as you can observe, and for my own personal observation, it really affects the relationship within the home environment, and the little mutual attachment and nurturing, inappropriate or shy or aggressive classroom behavior. It also affects to the performance inside the classroom of a child, academic failure, also low academic aspirations and poor social coping skills, affiliation with the deviant peers, perceived external approval of drug use, and parental substance abuse, or it can lead to mental illness. And for the protective factors, strong family bond must be observed, parental engagement in child's life, clear parental expectations and consequences, academic success, strong bonds with pro-social institutions such as the school, community, and church, and the conventional norms about drugs and alcohol. So we need to educate the child about these use of drugs and alcohol, that it can lead to bad consequences in the future. For the causes of alcoholism, first is hard physical labor. For those people who have this type of job, for example, are the medical professionals, the journalists and actors, and also other other jobs that required hard labor, that it can lead to alcoholism. For a sudden loss of properties or close ones, for such as who undergone bankruptcy or have death in their family or friends. Ignorance also. Suddenly, a person become rich or poor. Disorders like depression, anxiety, phobia, and panic disorders are come together, that it is one of the causes of alcoholism. Biochemical factors, or the alterations in the dopamine and epinephrine. The dopamine is a type of hormones that it is a happy hormones, and the epinephrine is the adrenaline of our body. And the psychological factors, which is the low self-esteem, poor impulse, escape from reality, pleasure seeking, and for the sexual immaturity. And lastly, for the social factors, wherein the overcrowding, peer pressure, urbanizations, religious reason, unemployment, poor social support, and also the isolation. There are four stages of process of alcoholism. First is the pre-alcoholic. So during this pre-alcoholic stage, there is a little evidence of problem drinking. The first involves general experimentation with alcohol, and is when alcohol tolerance develops as the person begins drinking more regularly as a coping mechanism for anxiety, stress, and other emotions. So here, the person is exploring what is the alcohol is all about. And for the early stage, the second one, according to Alvin Morton Jelenic, a biostatistician and alcohol abuse researcher, considers this the transitional stage where the development of a pattern of alcohol misuse starts. Drinking becomes more regular, and individuals begin using social gatherings as an excuse to drink. They may also start consuming alcohol to cope with the negative consequences caused by drinking, such as hangovers. For the third one, the middle stage, wherein this is the most crucial stage in Jelinek theory, when a person begins to drink frequently and consistently, maybe even starting off their day with a drink. They may struggle with worsening relationships with friends and family, or experience changes to their behavior that impacts them negatively. They often experience health impacts associated with heavy drinking, such as hangovers or feeling sick, more often than when not drinking. And lastly, for the late stage, wherein this final phase leads to a complete loss of control over alcohol consumption, where the person feels they must drink. At this point, the individual's body begins to require the presence of alcohol to feel normal, known as dependence. When the individual does not consume alcohol regularly, they may experience withdrawal syndromes and intense cravings. So, in this stage, the person are becoming more dependent on the alcohol, which they consume the alcohol as their everyday drinking, or drinking. It is their drinking pattern now, and by this, they experience the withdrawal symptoms and the intense craving.